Today, we are here to sign an MOU, and we have signed with an organization which is a community-based organization by the name Lwala. Lwala is a community-based organization which has been able to implement successfully the reduction of mortality rate in the hospital at Lwala. We have signed with them so that we can learn from them better methods of reducing mortality rate. Nyamira, we are having 349 mortality rate per 100,000 parts, which is below national average, but it's still very high. In the hospital, they produce or they give birth to 100 babies per month, and their mortality rate is 0. They have their own technologies which are simple, and with our partnership with them, which will take 5 years initially, in the first year they will give us 70% of the cost of implementation, and the government of Nyamira will give 30%. Second year, it will be 50-50 sharing of the cost. And we believe it will reduce until the 5th year, the county government will have taken over the project 100%. And we believe by 5th year, the mortality rate will have moved from 349 to 100 and below. Because we have to save our mothers, who are our producers.
My name is Julius Mbea. I'm co-CEO at Lwala Community Alliance, and today we have had a great opportunity to sign a memorandum of understanding with the county government of Nyamira. As His Excellency the Governor has mentioned, Lwala's focus is improvement of maternal and child health outcomes. And we know that as a country, we are losing far too many mothers due to pregnancy-related deaths. The country average is about 355 mothers dying for every 100,000 live births. The SDG target, that is Sustainable Development Goals for the country, is to reduce this to 70 per 100,000. And so when His Excellency is saying that we can work together to get this below 100 and even lower, it is within the aspirations of this country. And you know that the SDG targets are targets that countries have signed by themselves. Kenya has signed to reduce maternal deaths to below 70 by 2030, which is not even the 5 years that we are talking about. It's much closer. So this partnership is an opportunity for us to strengthen community health systems, ensuring that the National Program for Community Health Promoters is working well, that community health workers are trained, equipped, digitized, supervised, that the systems that they are using is driving patients to health facilities. And once they have reached the health facilities, for healthcare workers to have the skills and the knowledge to be able to serve. That is why part of this partnership will include training of healthcare workers mainly on emergency obstetric and newborn care using the guidelines that have been produced by the National Ministry of Health, as well as other interventions, looking at things like blood and blood availability, looking at supply chains, so that we can have a strengthened community health system in Nyamira. Like His Excellency the Governor has mentioned, if you look at Nyamira vis-a-vis averages nationally, Nyamira is slightly better than many counties, but you know you should not compare yourself with the worst. You should compare yourself with the best. And I think this MOU is about elevating the health status in Nyamira to be one of those that is high ranked across the country. Right now we are partnering with about 12 counties nationally to address obstetric hemorrhage as well as maternal and newborn health issues. And we hope that this partnership will be one of the flagships that we can rely on. Prevention is better than cure.